Hi everybody, I'm Nur-Ain Nadir. I'm actually with Kaiser Central Valley Modesto. We created a whole bunch of models, and over the years they've kind of evolved, and the two that I'd like to discuss today are the paratonsillar abscess and the lateral conthotomy model. And they're very, very cheap to assemble. I'm going to start with the paratonsillar abscess model. I love bubble wrap. This for the same reason where we were talking about creating the Bartholin gland abscess. You know, if you're trying to practice any kind of IND, period, if you use a giant bubble wrap, that actually serves as a really nice pressure-filled cavity. And there's a trick to doing it that I will go through. Basically, you start out by cutting out 1-inch pieces of bubble wrap, maybe about 3 to 4 inches apart, and you essentially need to thread a zip tie for a paratonsillar abscess through that bubble wrap. It somewhat looks like this. Okay, and it's kind of difficult to imagine how I'm doing this, but if you come to my station, I'll show you exactly how. Once you've got that assembled, you're essentially sucking the air out of an individual bubble wrap, okay, and then filling it with whatever you want. So I use chicken stock mixed with some milk to be a little bit more pus-like. You certainly could use tapioca, but the problem with that is that it usually clogs my syringe, so I don't use that. Once you have filled it up to nearly capacity, you basically seal the little hole with something like some kind of like glue. So I use, you know, what's Gorilla Glue or something like that. Yeah, that all works. And so it kind of looks like that when both the sides are filled. And this is just gluing it together. Once you have this, I actually use liquid latex. You can get it from Amazon for about $15, a fairly large bottle. And you basically dab it all around to kind of give it this fleshy, you know, appearance. You can definitely add color to it to kind of look a little bit more pinker. And so this is what it eventually looks like. You let it like dry out. I usually just leave it overnight. That's what it looks like. And then I've actually gone and installed it with a zip tie into an older airway model, something that's not really being used very much because obviously it can leak. And then I let my residents practice the drainage of these abscesses. So that's the PTA. For here, we don't have an airway model, but I do have like a cup just to kind of shimmy it into place, and I'll show you what that looks like. Same skills. So the Halloween lateral conthotomy model, I usually make these right after Halloween because most kind of masks go on sale on Amazon, and you can get like a box of 20 for like really, really cheap. These are the supplies you need. You need a mask, you need Halloween ping pong balls and eyeballs, scissors, white hair tie, ideally any color hair tie is fine, it's not really that important. Needle, thread, if you don't have needle and thread, you can grade your hospital stores and just get suturing material, that works. A mannequin head. Basically, invert the mask inside out, stitch the hair tie in place. Okay, so usually you get the inferior and the superior ligaments for that. Take the eyeball, shove it into place, place the mask over the styrofoam. You can actually also build this for a regular mannequin, so instead of using the styrofoam head, you can actually place the mask on a mannequin. One ambitious standardized patient also did this. I was a little bit nervous about it, but they did it. Anyway, just make sure it's snug around their face, and then you basically repeat it on the other side. And so you can kind of go ahead and cut it open. What it allows you to do is allows you to feel the little sort of give, and the ping pong balls, especially if you are holding the mask with enough pressure, literally just, you know, jut out. Sometimes they fly across a room, but you know that basically points the purpose that you got you're done with relieving the pressure. Okay, so hopefully we'll see you there.